Hi, everybody. I'm Deb Hackenberry. I will be the facilitator of tonight's DCIS Roundtable. I want to thank everyone for joining us, and tonight we're going to be discussing health literacy. The good news, bad news today is that because of the internet, we have such a wealth of information at our fingertips. But how do we know which information we can trust? Is it evidence-based research or someone else's personal story? Today, we are pleased to have Antonio DeRosa with us to help navigate these tricky waters. Antonio is the Oncology Consumer Health Librarian at Weill Cornell Medicine here in New York City. The format today will be Anthony's presentation, followed by a Q&A, and if there's time, we will then have a support session. So thanks, and Anthony, if you'd like to get started.
Sure, great. Thank you so much for that. And thank you all for having me. I'm very excited to be here. So yes, I'm going to be talking to you today mostly about health literacy, but also how you can improve your health literacy to help you make more informed decisions about your care, or if you're a caregiver, your family member or loved one's care. So we're going to do that by first talking a little bit about finding reliable information, right? Where to go, how to discern the good from the bad, and then also evaluating the resources that you do find before kind of presenting them to your providers and your care team to kind of have that collaborative conversation about your care moving forward. Okay, so on the left here is just sort of this flyer that we have throughout the hospital and the medical center for patients to see that there's a resource for them, cancer patients specifically. Myself here in the Patient Resource Center. So Weill Cornell Medicine, we're located on the Upper East Side of Manhattan. The Patient Resource Center is actually a public location as well. Our main charge is to support all patients of New York Presbyterian and Weill Cornell Medical College. But if you come to us or call us with an information need related to health and medical, we'll be happy to help you with that as well. So my whole goal, right, my whole role here is really to support the information and research needs of the cancer population. So I work really closely with the Patient Resource Center where I'm situated, the library, because that's where the resources are and that's where my faculty appointment is, and also the Cancer Center and the Oncology Service Line in the Medical Center. Another resource that I provide patients, because a lot of them kind of need that, especially more the newly diagnosed, they're a little overwhelmed or feeling like they need a little bit more support. I connect them to some resources for coping. So we have a fleet of social workers that they can kind of tap into if they feel as though they want to. And so my whole mission here is really to, when I'm working with patients, is to help them stay informed and feel confident and empowered to make decisions about their care. Of course, in partnership with their providers, their physicians, the rest of their clinical team. So I'm going to start us off with a video. So this is what we call an information seeking scenario. So this is our character, her name is Sasha. So you'll see that she kind of gets herself into a little bit of a situation, but she pulls herself out of it in the end. And so this is not unlike situations that we've all found ourselves into. I mean, I'm, a victim of this sometimes too. It's just a matter of knowing the signs, paying attention to them, and doing, what needs to be done to kind of take a different path with information that you're finding that's out there related to your health especially. So there is supposed to be some sort of background music to this, but while testing this, it didn't really work. So it's just going to be silent for you on your end. I'll chime in if there's anything I can kind of input, but it's self-explanatory, it's all subtitled, so you're just going to have to sort of read through, okay? Here we go. So there's Sasha. So right, she's doing the right thing. She has some questions. And she's looking for answers. So this is perfectly appropriate. This is what everyone does. But did she get to the right information? Uh-oh. So that could have been the end of her story, and it probably is the end of a lot of people's stories. But not our character. She has the tools and resources necessary to change her path here. Good job, Sasha. So I hope you enjoyed that. Sort of on a really kind of basic level, issues that we all kind of come across while we're searching for information, right? Of course, it's a little more nuanced than that. And we're going to get into some of those specifics right now. Okay, so where do you start, right? So like our character, like Sasha, she had some questions. Where did she start? She started searching. She hopped on her computer, she pulled up some resources perhaps, and she went on her way. So since that is a starting point for most of us, I'm just going to, on the next two slides, give you a few examples of some trusted and reliable sources of information on a number of health topics, so not only cancer specific, okay? So this first slide here, these are what we call consumer health resources or consumer health websites. You all patients, all of us are patients in one point or another, right? We are consumers of health and healthcare. So that's where the consumer piece comes in my title and the work I do, and these consumer-based resources. So if I say consumer, that's what I mean. So the first one here, Medline Plus. This is probably the premier consumer health resource that exists on the net right now. This comes directly from the National Library of Medicine. It's all aggregated and updated by them. It has information on a number of diseases, conditions, health and wellness topics. It's all written in a very simple language, so kind of at a lower health literacy level to encompass, the broader population. It's very reliable. It's up to date. What's nice is that you can get this anywhere. They have a mobile version of this as well, so you can kind of have this, right at your fingertips, literally, in your purse, in your pocket. And there's also the whole version of Medline Plus exists in Spanish. So it's not like other resources you might come across where certain pages or certain documents are in foreign languages or other languages. This entire instance of Medline Plus that exists is replicated in Spanish as well. Health Finder. This is another one from the National Institutes of Health. And it is a little different from Medline Plus. It has some similarities, but a little bit different in that it's a little more kind of generally focused. Medline Plus, you can probably get to some more specific information in there. But if you're looking for general information on, breast cancer treatments, for instance, as an example, this is a good resource for that. It's a kind of a higher level overview of health and medical topics. And what's nice about this too is that it incorporates not only government documents and government resources, but also points you to resources from other nonprofit organizations. So it doesn't work only within sort of the federal system of information. It'll send you out to kind of other resources that exist out there for you. And then of course I'm putting on here the American Cancer Society. Cancer is sort of my patient population. You are all in that population as well. So the American Cancer Society has really, really good, and again, written at a kind of simpler health literacy level, informational pages. They have patient education leaflets. They have a lot of information about specific medications on there too. So it's a really good go-to resource, and it's really detailed too, which is nice. Okay, so these next three that I'm going to recommend are more scientific and scholarly based, right? So they're going to give you, more of this sort of published literature evidence that exists. So the first one here, Medline. This is also from the National Library of Medicine. Your doctors and all of your clinicians, all of your care team will definitely know what PubMed is. This is I would say the premier biomedical database for healthcare providers. So it's essentially an index of articles that are published in journals. It has over 28 million citations covering the biomedical literature and kind of other life sciences journals as well. It has some books. They're just getting on board with sort of pulling in books into this database. So there's not as many as you will find journal articles or papers, but the books are in there as well. There is this component to PubMed called PubMed Central, or you might hear it be called PMC. And this is essentially the free text, the free full text version of PubMed. So that portion of PubMed, all those research articles and studies that appear there, full text that anyone can access from anywhere. Again, this is all public facing. They're put into this PubMed Central database because the research was funded with federal dollars. So a mandate of the government is, if we're giving you research money to support your research, your findings and ultimately what you write up and disseminate out to the world needs to be made publicly available. So that's what PubMed Central is for you. And PubMed Central is very vast and large as well. So, you can get to it right from PubMed. They kind of link to each other and it's really nice and easy. So if you find yourself kind of operating at this higher literacy and health literacy level where you feel comfortable with reading some scientific information or evidence or the literature itself, PubMed is a good spot for you. The TRIP database. So TRIP, T-R-I-P, stands for Turning Research into Practice. So just by its name, you could tell this is a very evidence-based resource. And when we say evidence-based, we mean these are specific types of publications or articles or research that are written up and put together and based on very large portions, if not all, of the previous evidence that came before. So evidence-based medicine sort of builds on itself, right? So research that was published in the past that's focused on an area that you're currently focusing your research on, you're pulling that in and you're taking that into consideration when you add to that research base and you make suggestions or recommendations. That's what we, on kind of a simpler form, call evidence-based medicine or evidence-based practice. And so when researchers want to find, an article or a study to support a unique patient case that they're dealing with, for instance, they would come to resources like PubMed or the TRIP database and look for articles that are higher in evidence or that, have more evidence to them from prior research and prior literature to help inform their decision-making on the clinical side of things. But what's nice for the patients with TRIP is that since these are all evidence-based, they have other media in their resource, which is really nice. So they have some images, videos, and what I love about it are these patient information leaflets. So if you go to TRIP and you run a search on your diagnosis or a potential treatment, you're going to see ways to limit the search. So you can search by type of article, and that's all about the evidence. Or you'll see sort of a tick box for, I want to see only patient information leaflets. So something that's, again, written at kind of a lower level, a little more understandable perhaps for the general population, might be useful for you. So that's why I like to recommend the TRIP database to certain patients that I see, again, those that are kind of operating at a higher level in terms of understanding and acting on information that they're presented with. And the last one here, again, sort of more of a cancer-focused one, is these cancer publications from the World Health Organization. So the WHO, the World Health Organization, is very large, right? It's a global entity, and that's reflected in their website. There are lots and lots of pages. There are pages within pages. And so what's nice here, I'm providing you with this link. This will bring you right to the cancer publication. So they have a whole cancer section, and what these publications specifically as part of that section contain are, information on prevention, early diagnosis and screening, early detection for certain cancers. So there's this sort of awareness and educational component to them. But it was also nice is that if you're more of kind of a stats or a data person, and you were just presented with a diagnosis or diagnosed with a specific cancer, and you want to know, how unique is this, right? Or how many people in the United States or in my area have this versus, people in Germany or something. I mean, some people are inquisitive that way. It helps them kind of conceptualize their condition. This is a good resource, the cancer publications, because it has profile data, right? So this will give you data that's country specific on different cancer types. So that's just a nice cancer focused one that some patients find very helpful. Okay, so you've come up with some questions, right? You've at least had some initial questions that you wanted some answers to. You found some information. Now what do? Well, firstly, we do not want you to fall into a trap, right? So those resources I just recommended are going to be good, reliable sources for you, but they might not contain all the information that you're looking for or an answer that you're looking for. So you may need to kind of branch out and look for some other sources, whether you're Googling or, stumble upon websites, however that may happen for you. We do not want you to fall into a trap. So here are some tips or suggestions for you to kind of evaluate the resources or the information that you come upon through your searching, okay? So a quick way to look or evaluate a resource is by looking at its domains. So by domain, we mean the ending of a URL or a link when you get to a website. So you're looking around, you land on a page, that bar that's at the top of your browser has www. or http. a bunch of words, one of these domains / whatever else happens, right? So whatever that ending domain is what you want to pay attention to in regard to evaluating it, right? So there are many others than this list. These are just sort of some of the bigger ones, so that's why I have them on this slide. But the .edus, right? So the purpose of these types of resources or domains that exist online are usually just to purely, educate the reader, right? They seek to just educate, which makes sense because they come from universities or colleges, right? The .edu domain is reserved for the educational system in our country. .orgs, right? So .orgs are mostly nonprofit organizations, and they, by and large, seek to educate, but there can also be some instances of bias or prejudice in the information that's presented. And this is in the way of, think about a charity organization. They're in the business of, bringing in funding, perhaps, right? Or bringing in more followers to their social media or whatever it may be. So the information they present, while factual, I would say that most .orgs, I would rely on that information. Just be aware that some of it might be sort of skewed to their own interests because they are still in, the game of needing something. They're in that kind of market, right? And actually the same could be said for .edus to a certain degree. .govs, okay, so these are my go-tos, right? Actually, the two out of all this list that I send my patients to usually, or I try to push to them, are .govs and .orgs. So .gov, these are from state or national federal agencies or bodies. And they really do seek to just educate the reader. You know, they're being created with our tax dollars, and you know, they are very reliable. I mean, again, in my world, I'm always on the National Cancer Institute website. I'm on the National Institutes of Health website. I have never noticed anything on either of those two that have, you know, struck me as, oh, this actually is, you know, biased, or I don't think this is really correct. So, you know, .govs are pretty much safe spaces for you. You could think of them as. The next are kind of the rest of the domains, more of these commercial domains, right? The .coms, .biz, .net. There's several others. But these are usually from the private sector, right? Or these for-profit companies, or the commercial area or arena. So the purpose of these, they can seek to educate you, right? But ultimately, you know, they're more so in the business of making money than, you know, some of the others on the list, .edus aside from educational systems. You know, they're really kind of selling products. They're trying to push something to the consumers, to the users. So you are going to find some bias and prejudice in their information, definitely skewed toward their, you know, let's say findings on you know, this product will take away X symptom if you have X cancer, that kind of thing. So just kind of beware. I mean, I wouldn't rule any of these out. I'm never the type to say, don't even go to .coms or .bizes. I think that you can find good information on those types of websites. I just think it takes a little bit more of your own, you know, stepping back, evaluating, thinking about what you're reading, and realizing where it's coming from, okay? All right, so some warning signs to help you through that, right? So now that you have the domains down and you can kind of think about those in terms of searches that you do, we want to get into some of the warning signs that some of these more kind of predatory websites will have, or, you know, the verbiage that you'll see. So of course, claims of some breakthrough or a secret ingredient, or, you know, an ancient remedy to miraculously cure you. I mean, these sort of big, grand, and a little fantastical terms should really be a kind of a red flag in your head, definitely. You know, products that can cure a wide range of illnesses. I mean, we know that no one product can cure swaths of diseases, right? I mean, some products exist that have dual benefits, right? Or maybe 3 or 4 benefits to different types of conditions. Those definitely exist. But, you know, again, look out for the way these things are written, and kind of, you know, how they're presented to you. Stories of people who've had amazing results, right? That's great. My patients love hearing from other patients. I think it's such a good way to understand your disease. And online is fine. There are plenty of online forums out there where people are sharing stories. But what I would caution is that if there's no sort of data or evidence, you know, to back that up, that's where you need to kind of question things, right? So if you come upon a page or one of these, you know, discussion lists or forums online where somebody's talking about this worked for them and it was so great, inquire about it, right? If you happen to be registered with that site, why not ask them a question and just say, you know, where has this been studied? You know, can you kind of provide more information? Do some more searching on your own, right? PubMed you just introduced you to, you can maybe find an article on there or something, or another resource to kind of link to the results that this person is talking about that are so amazing. So just, you know, data is key, evidence is key. It's a good point. Claims that a product is available only from one source, right? So this goes back to the whole commercial or kind of private sector. A lot of those websites will say, oh, this will do this for you, and it's only available here, get it now or get it while it lasts, or something like that, right? Of course, claims of a money-back guarantee. I mean, you most likely will not be able to get your money back if or when the product, if you choose to purchase it, does not work for you. And at that point, you would have given some of your personal data, like we saw with our character Sasha, right? Some of your personal information, your financial information to a website. Also, and I put this one for last because it's a pretty big one and one that folks don't really think about. really evaluate, and this really comes down to when you find information that you do like, or you do think is good, or you do think would be beneficial for having a conversation with your care team or something. These websites or these entities, whether they're organizations or companies, they should have physical addresses, clear company names, working telephone numbers, and other contact information for you. I mean, we live in a time where communication is everything. So I would say what I do sometimes when I come across these pages and what I recommend to my patients is to simply Google the address. If there's an address on this website, you take that, you plug it into a different window, a different browser, google.com, see where it is. If it's from an offshore, a different country, away from U.S. laws and regulations, that is sort of a red flag. Also, I've done this before, and it's just directed me right to the middle of the Atlantic Ocean. So a lot of these addresses are just completely arbitrary and made up. Some of them just are lead you to open vacant lots or parking lots, for instance. A lot of these phone numbers don't work either. So if you're so inclined, try to pick up the phone, see if it works. So that's a big one, and one that I think is a little under the radar for a lot of people. Okay, so you've had a couple questions, you went to a couple reliable sources, you found some information that you think would be useful, you've evaluated it appropriately, you feel as though it's evaluated appropriately. Now what do you do? So this is sort of at the core of all of this, right? So aside from the information seeking and all that behavior that took place before, now we're shifting gears a little bit. Now you're preparing yourself to really be a partner in your care, right? With your care team, with your doctors. And so this is what I refer to as BAP, very easy to remember, BAP, however you want to pronounce this. And that's brainstorm questions. A for ask your cancer care team. And be a partner, that's the P, be a partner in your care, right? And coincidentally, after putting this together, I realized BAP can also stand for be a partner, so you won't forget it. So first one here, brainstorming questions, this is very important. So you want to be sure you take the information you have, whether it's what you found online or elsewhere, or information you received from loved ones, or maybe an expert in your family or a physician in your family or something, whatever it may be. Gather all your information and think of questions to bring to your doctor during your next visit. I recommend that you write these down. Bring a little journal, bring a notebook, write these down, because sometimes, depending on the situation, you might feel as though you're a little overwhelmed, which will cause you to maybe forget some questions. Other feelings might get in the way, unforeseen circumstances. You had a bad commute in, for instance, you're a little thrown off your game, right? I mean, this happens to all of us. So writing these things down is very important to make sure that you're getting all of your major points and questions across to your doctor, okay? Also, expanding your medical vocabulary is a good idea, especially if you have, questions about certain symptoms or certain medications that are a little hard to maybe pronounce, or you don't really understand, what they're used for. There are plenty of free medical dictionaries online. That is just, they're everywhere, they're abound. So doing a little bit of homework in terms of, plugging these words into one of those dictionaries, just to kind of up your knowledge a little bit, right? It'll only help for you to have a more constructive conversation when you do sit down with your questions during your visit with your doctor. Okay, so next is asking those questions, right? So the first and biggest thing here is that we do not want you to be intimidated, right? You should not have a relationship with your doctor where you feel intimidated. A little bit of an intimidation is okay. I'm not saying that's a bad thing. I just am a proponent for having a good working relationship with your doctor where you feel as though you can have communication going both ways, and you're being heard and they're hearing you, right? Or vice versa. So don't be scared, don't be intimidated, ask the questions you have, and it's good to come prepared, right? Because we all know doctors don't have a lot of time. They have maybe 15, 20 minutes with you during a normal consultation, a normal visit. So, coming prepared is going to show them, oh, you prepared for this, and you are, respectful of the fact that I can't sit down with you for so long, no matter how much I would want to. So they will be receptive to that, right? So one thing that I wish I added to this bullet list here is that during your visit, if possible, I think it's so important to bring along with you a caregiver, friend, family, loved one, somebody to kind of help you fill in the gaps, right? Because you can be prepared, again, like I mentioned before, feelings get in the way, unforeseen circumstances happen. Sometimes you leave an office visit not really absorbing all of the information that you would have liked. And that's okay. That's what you have your notebook for. So take your notes as much as possible. But then also that caregiver you bring along with you will be a really good resource after the fact to say, oh, no, you wrote this down, but the doctor really said this. And you can have a discussion with them and you can really kind of fill in the gaps that way. And finally, we want you to be a partner in your care, of course, right? So the whole idea of patient-centered care is offering care to patients where it's about them, the focus is on them. So who better to be participating in their care than the patients, right? This is happening to you. So, educating yourself on your treatment, your diagnosis will only help you feel comfortable in making more informed decisions, right? If you're presented with a couple of treatment options or whatever it is, depending on how the conversation goes with your doctor, you'll feel more, confident and in control and empowered to make those decisions in conjunction with them, right? And of course, being a collaborator and a partner in your care will only improve your overall outlook, right? So if you are participating throughout the whole care plan process, ultimately you're going to have more confidence in the treatment you're receiving, right? Or the path that was chosen because you had a say in it. And so before I take questions, I'm going to leave you with this quote, which I thought was just sort of perfect for this presentation. It's by former President Bill Clinton, September 8th, 1994, on International Literacy Day. Literacy is not a luxury, it is a right and a responsibility.